Good afternoon, everyone, and thank you for joining us for our fifth town hall addressing COVID-19 in Delaware. Once again, we're privileged to have Dr. Alfred Bacon join us. He's been with us this whole time, and I think we finally all feel like we're headed in the right direction and things are looking up. So we're pleased to have Dr. Bacon join us again today. Doctor, before we get started, I feel like I've never given you a proper introduction. We've just jumped right into the science, the health and the science. And I just wanted to see if we could spend a minute or two talking about you and your professional career. You're a native Delawarean, is that right?
Yes, born and raised in Delaware.
Right. And where'd you go to medical school?
Jefferson Medical School. Like many Delawareans, there's a link there. And after that, went to my residency program in Lankenau Hospital in Philadelphia.
And what did you begin to specialize during residency, or was it after that?
I spent my first time doing infectious diseases while in college. I spent a semester doing research and laboratory in Delaware in infectious diseases. And then in medical school, I did rotations in infectious diseases, and then internal medicine residency was 3 years, and then following that, a 2-year fellowship in infectious diseases at the University of Michigan.
What is it that attracted you to specialize in infectious diseases?
Well, it really is a perfect mix of science and clinical medicine. You know, infectious diseases is internal medicine at its the epitome of internal medicine. The clinical picture guides the laboratory investigations, which then are used to solve a problem, and then you move it forward and benefit the patient. So I think it's a wonderful mix of clinical, as well as most infectious disease practitioners participate in research and some teaching and clinical. So it's the three heads of medicine that sort of come together nicely. So I've enjoyed that.
And what is your current position?
Well, I formerly was a program director, associate program director of medicine training residents. Now I'm what's called medical director of clinical trials for the Department of Medicine. So that's research-oriented work and teaching work as well. You know,
okay.
But mostly just infectious diseases, hospital-based.
Okay. And could you just give people a flavor for what your typical day is like when you're in the hospital?
Well, I've chosen to do mostly hospital-based work. I think that's where the sickest humans are. And so my group of 5 MDs and our team will see predominantly intensive care unit patients, transplant patients, leukemics, sick individuals that are hospitalized, acutely ill, and participate in the care of those people as a consultant. And then hopefully some will see as an outpatient afterwards. If they have deep diseases, we manage it with intravenous antibiotics. So my day is usually spent on rounds throughout the hospital, seeing patients in various fields, surgery, OB/GYN. We cross a lot of different boundaries.
That's great. Well, thanks for sharing that with us. And my apologies for not giving you a proper introduction before today.
That worked out well, don't worry, thank you.
All right. So why don't we go ahead and jump into the presentation if you want to share your screen and get started.
Thank you. No, thanks for the introduction. So today's discussion will certainly be a tad more positive. I think that we're seeing a really nice movement in the setting of COVID in Delaware in the right direction. Everyone's feeling that positivity. I think I'd like to start off, we're going to talk about the current epidemic curve, talk about the variant data. I assume my slides are visible to people?
Not yet.
Oh, I've done that again. Well, let's just go back and start. Is it visible now?
Not yet.
All right. Well, we're going to go to share.
There you go. I think I just saw the screen come up for a second.
We should be good now.
Yes.
Good. We all set?
We are. Perfect.
So I'm going to talk about the current epidemic curve and status in Delaware, discuss the variants, how they're affecting us to some extent. And then vaccination is the hot topic, obviously. We'll get into vaccination, what the numbers are. And I do want to spend some time talking about vaccination hesitancy, which is a nationwide issue. And we'll talk again about CDC guidelines for distancing, masks, and activity. I'm going to start today with a case, and this is how I usually start a discussion with my colleagues, a case that was recently hospitalized, very briefly, obviously. And this case is designed to show you that vaccines are effective for individuals, but they don't work for everyone, particularly the immunosuppressed. And this case tells me that we need to remain vigilant to protect even our more fragile members of the population. 87-year-old woman with a history of lymphoma on chemotherapy, received a month ago, most recently. This individual was 4 weeks out from having received the Moderna vaccine, the 2-shot vaccine, and well past the vaccine status of successful, if successful. Lived with her family and presents with a 4-day history of shortness of breath, fatigue, and was told she had pneumonia, treated with antimicrobials. The morning of admission, EMS, emergency service, were called to her home. The family was undergoing CPR in progress. She survived that event and was admitted to the medical intensive care unit at the hospital, intubated at that time, requiring significant support for blood pressure, progressive fulminant pneumonia, respiratory failure, and she arrested and passed away. Now, there are many things that will make an 87-year-old with lymphoma and chemotherapy sick. In this case, it was COVID-19, or a combination of COVID with other factors. But COVID vaccine is extremely successful. You see data showing 99% efficacy preventing death. That's true, but there's that group of population which will not demonstrate a good response to the vaccine. And there are always going to be people out there you may be passing in a crowd who are at risk for further disease. And this is what drives me, at least, to remain some vigilance and mitigation. The numbers are excellent, obviously. This is the United States data showing the peak that occurred certainly in end of December. We felt that peak, and downward trend is continuing. Delaware data mirrors what's going on nationally quite successfully. And I think that's we've seen that the case all along. Current dashboard of Delaware is incredibly positive. 73 currently in the hospital. End of December, there were 500 hospitalizations or more. 119 average daily new cases. Percent positive tests being performed. This is the 7-day average of 100 people getting tested, 3.5% are positive. 100 tests being done, I'm sorry. This is excellent. Back in December, as you know, it's 10% at least, probably more. So clearly an improvement in the status, but we still have people getting disease. We still have people in the hospital, and we still have people that are positive. This is data from previously discussed. The crowded areas are where people are getting disease. And it reminds you that if you are vaccinated, you can go to a restaurant with vaccinated individuals. However, in that restaurant, there are probably unvaccinated individuals, perhaps. This is still an area where there are crowds, there are humans. Religious services remain high as well, gyms, et cetera. But I think that crowds remain an area of concern. Excellent slide showing the percentage in change of daily COVID cases and deaths since January 1st nationally. Dramatic drop, 75% to almost 80% downward trend in cases and in deaths. So the country is moving in the right direction. And I think the United States may be leading the way in COVID vaccination and COVID mitigation. Talking about the variants, though, this is the variable of concern because the variants have different sensitivities to neutralization from the vaccines. I'm going to talk about that in a minute, which vaccines work and which don't work as well. They all work quite well, actually, against most of the variants. We talked about this before, but the UK variant remains the dominant variant in the Delaware and Delaware Valley area. The South African variant is now increasingly common. These are both quite well neutralized by our current vaccines, without a doubt. The only area where there's a hole is the AZ vaccine is not as strong against the South African variant, but the AZ vaccine is not being used in the United States. Brazilian variants are concerned. There are some new variants coming in, and each variant gets looked at in a laboratory to see where they stand with respect to the vaccine efficacy. So B117, the UK strain, remains a dominant one in Delaware. The 1351, the South African strain, is increasing. These are well handled by the vaccine. They do spread more readily, though. We now have one case of the India variant that arrived in the States about 3 weeks ago. I took care of that patient, and we did confirm India variant of concern. This variant in particular does spread much more rapidly and has increased virulence with a high load, and it's a variant to watch out for. All the vaccines we have are active against the B117 and the 1351, although the AZ is less active against the South African strain. I'm going to show you that data in a second. A busy slide that has very few points to make. Looking at the vaccines, Pfizer, Moderna, J&J, AZ, and the various strains down the left side, the various variants. The 117, 95% efficacy. The Pfizer, I'm sure Moderna is the same number. Same thing's true of the South Africa. Still good activity, 75% is actually very good for vaccine efficacy. However, the South African variant is not as well neutralized with the AZ vaccine. So we still have the vaccine efficacy, which is what we want against these variants. These vaccines are working very well against the variants. This is a race between the variants and the vaccine. Now that the India vaccine is here, that's being looked at, and that actually is surprisingly good. The vaccines are effective. I saw an article this morning against the India variant strain. Protection from severe disease, 90% in trials. In the real world, 97%. Protection from hospitalization, 94%. Still means 6% of people who've been vaccinated can still get sick from this virus. Hence, we must remain vigilant and cautious to a certain extent.
Doctor, how does these mRNA vaccines stack up against the flu vaccine?
In terms of efficacy, that's a good question. The typical influenza vaccine has efficacy in the 70% range or lower some years. So this clearly stacks up in terms of, is it as good versus COVID as influenza vaccine against influenza? The answer is yes, as good or better. The science here with the mRNA is really part of the issue. So fully vaccinated in the state of Delaware, 300,000 with 2 doses. The data in Delaware since January, the yellow spikes are the partially vaccinated, blue fully, as you can see, we're now taking over with blue. January into April and May, daily vaccine doses relatively high, up to 8,000, 8,500. However, we've seen this tailing downward, and this is a topic of discussion. We need to get everyone vaccinated if possible. This is the daily vaccine dose administered in Delaware by date. Rising, the trend is beautiful. Of course, the trend continues upward despite the fact that as of probably May 1st to May 2nd, a dramatic drop in daily vaccinations. Part of that is because we have perhaps people that don't need the vaccine. Part of it is vaccine hesitancy. Looking at the Delaware COVID-19 vaccine data, all ages, at least 1 dose, 46%, fully vaccinated, 37% as of May 20th. 16 plus age group, 56% 1 dose, 45% fully vaccinated. And this is really strong data. 65 plus age group, 89% 1 dose, 80% fully vaccinated. That is really speaks to excellent public health delineation of data and vaccine. But what is going to happen? If you look at, this is data from a company called Sergo Ventures, which is a bipartisan survey group, and it's looking at why the vaccine numbers are dropping nationwide. If you look at the original curve of vaccination beginning earlier this year, 31% as of the middle of March, and it was going up like a rocket, suggesting that by July, we'd have almost 90% of all adults, 100% of all adults, 80% of all US residents vaccinated. Well, that has obviously not been achieved. If you look at the curve, the red curve is what's actually going on. There's a plateau developing, and Sergo's data projects out that we'll see a plateau going through the next year, out to this point, which is April of 2022. So we've seen a clear-cut plateau in vaccinations, and I want to talk about why that's happening and how we can look at that issue. Before I do that, though, we'll look at where it's most hesitant. This is geographic distribution. There's hesitancy everywhere. I mean, this is not a geographic fact, yes or no, but there's a wide range of populations that are hesitant or more hesitant. The clear or yellow areas are populations that are increasingly or strongly hesitant against getting the vaccine. You see it geographically Midwest, some in the South, and certainly upper Midwest. This is why vaccination helps in the concept of herd immunity. It's a wonderful paper that was published in the New England Journal about a week ago. It looks at nursing home, extended care facility residents who are vaccinated, as well as those that were not vaccinated. So it's a closed population where they both affect each other and they can help each other. 18,000 nursing home residents received the vaccine, the 2-dose vaccines typically. This is disease state in those who receive vaccine 0 to 14 days and 2 weeks to 1 month out. So after your first dose, you're still at risk for the first 2 weeks. And 4.5% of those individuals had disease during that time frame. However, after 2 weeks, the vaccine starts to kick in, even before your second dose, and the numbers drop to 1.4% get disease in that closed population. Those individuals of the 13,000 that received both doses, it was even more dramatic drop, down to 1% within 2 weeks of that second dose and 0.3%. So in the 18,000 vaccinated individuals, not only was a significant drop in disease state, 0.3 and 1%, but most were asymptomatic, which is really a telling point, and decreases transmission. Now, the reason I show this paper is because if you look at the population of nursing home residents who did not get vaccinated, of that population, 4,000 were studied who were never vaccinated. But as the vaccination clinics were taking place, we looked at how many of these 4,000 people acquired disease 2 weeks, 4 weeks, and 6 weeks out from the vaccination clinic. They weren't vaccinated, but they were living with other vaccinated people. You see a similar drop in disease state in this population. This is the definition of, quote, herd immunity. You now have a large population vaccinated, and that large vaccinated population protects the unvaccinated, because the disease episodes dropped from 4% to 1% to down to equivalent to those that were vaccinated. So you protected the whole population by getting 80% of them vaccinated. This is just a wonderful description of how getting vaccinated helps your neighbor, it helps your colleagues, it helps your friends, it helps that woman in the grocery store you're walking past who happens to have lymphoma and is on chemotherapy. So I really think that this demonstrates how vaccinations help a population as much as the individual. These vaccinations are safe, they're widely available, they've gone through extensive clinical trials. 272 million humans have been vaccinated, doses have been given out. So we know that based on this vaccine efficacy, it's strong. The safety profile is very similar to those receiving influenza vaccine, even better in some aspects. But the key to getting vaccinated is you'll protect yourself and the people around you who are at risk for getting severe disease or severe illness, those in our population who are the weakest. Now, COVID-19 has serious life-threatening complications. We know that, and there's no way to know how you get affected with it, if you'd be sick or non-sick. So there is a breakthrough population in the vaccine population. I've seen maybe 5 admissions in breakthrough. They're not very sick, frankly, and they don't spend much time in the hospital. We know clinical trials show it's safe. It's under what's called investigational use right now. But however, it does offer protection and natural immunity also. If you have COVID, you certainly have natural immunity as well, up to 6 months. We don't know how long that lasts. That's why if you've had COVID disease, it's still recommended that you get vaccinated. And after you're fully vaccinated, you may start doing things you stopped doing. If you're vaccinated, you may be outdoors with any individuals. You may be indoors with other vaccinated individuals. However, it is suggested in aggressive public places with large crowds, you continue to wear a mask and you continue to mitigate with social distancing. That will prevent those small populations that are high risk still from acquiring disease. And you're not considered fully vaccinated for 2 weeks with the Moderna Pfizer, 2 weeks with the J&J. So once again, the benefits of getting vaccinated: you will be wearing masks and distancing in public places, the federal government sites, obviously the court as well. However, fully vaccinated people are much less likely to transmit it to other individuals. We know that, and certainly to acquire disease. You know, stopping a pandemic requires all the tools we have available. We don't have a lot of tools available. The vaccine is a tool we have available. Mitigation, masks, distancing are tools we have available. There's no additional treatment beyond supportive care, and we know steroids. There's no new treatment or intervention that we have. So these are the tools we have. We should use them optimally and aggressively. Over 272 million doses of the vaccine have been given, felt to be safe and effective. We'll talk about the safety profile in a minute.
Doctor, before you go on, could we know the CDC, I think, is down to 3 feet now in certain circumstances versus 6. What's going on with the 3 versus 6 feet?
I don't know the answer to that, and it's a good question. I'm not going to answer if I don't know the answer. There's been suggestions that in a school situation, 3 feet is reasonable because children are less likely to spread disease and not as sick with disease, but I don't know that officially.
Okay.
Obvious side effects: pain in the arm, you feel ill at least 24 to 48 hours later, certainly headaches, tired, fatigue, drink a lot of fluids, take care of yourself, try to have a light day the next day. I think that I want to talk about vaccine hesitancy and then get back to some of the side effects issues to finish up. A really nice study, which I've already alluded to, the Sergo survey, looked at why individuals don't want to become vaccinated. And I think it's like anything else in the world, there's a bell-shaped curve of individuals that are embracing this vaccine and not embracing this vaccine. I think it's the way the world is, and I think it's appropriate. I really do. There's certainly a population of people that are called enthusiasts. This is the 5 levels of acceptance that has been used in this survey. These people are wanted to get the vaccine before it came out. Healthcare providers, for the most part, individuals that were eager to help, population-based view of the world. I think that enthusiastically embrace the use of vaccination. There may be a varying time to that embracement. Some said 3 months, 6 months, but enthusiasts are going to get the vaccine. Then there's a population called the watchful population. This probably represents about 8% of the national population. This is a population that wants to see how their friends do with it, wants to make sure their colleagues have had it, and they kind of can be more accepting of the vaccine if people around them are vaccinated. That's actually very normal human behavior. Then there's a cost-anxious population, which you can't argue with this. This is a free vaccine. It doesn't cost you anything to get the vaccine. However, there is a cost to the vaccine. Taking a day off from work, perhaps, losing a day from work, having pain, not wanting to have that pain or discomfort. So there is always a cost to everything. So people have to wait. There may be a large distance to travel to get vaccinated. I do think these issues can be overcome as well as the watchful, but that's up to the individuals. Then there's a population of what's called system distrusters. This is a really valid population. There are populations in this country that have been treated poorly. In the research arena, obviously, I can point to areas where people of color were treated differently in that area, socioeconomic groups. The prison population was treated poorly in many areas, up until many safety guardrails were put in the research arena for that. So there are people that don't trust the system. I can't tell them to trust the system. Trust is a two-way street. We have to demonstrate that trust, demonstrate our skill set, and I think we use evidence-based guidelines to do that and data to do that. But I also think that this is a valid point. And then there's science skeptics, people that basically don't believe COVID is a significant disease or don't think the science behind what we've talked about is valid. And I really have difficulty reaching that population, but it's a valid, I'm going to say it's valid, but it's a point of view that people are allowed to have. Now in Delaware, if you look at the population enthusiasts, watchful, cost anxious, distrusters, and COVID skeptics, Delaware ranks first in watchful. I think that's, of all the groups, that's a good group to be in, frankly. I think you're being thoughtful, you're being cautious. Typical Delawareans, having grown up here, as I said earlier today, I think we have our own, I wouldn't say we're provincial, but we certainly want to be watchful. And this is what we're doing here. I don't think we're seeing a lot of system distrusters in this area or COVID skeptics, but we're going to see that. This varies geographically. The watchful group typically moves into the vaccination group. So I think the next X number of months, moving our colleagues and friends into the vaccination group, if they so choose to accept it, is the way to go. Side effects you want to hear about: number 1, fever, myalgia, pain. I'm not, this is really, can be really uncomfortable. So, it's 24 hours. I can't tell you how many people have said, I feel fine, no problem. But now and then it gets pretty rough. Anaphylaxis, which means respiratory distress, asthma type reaction. The data now shows 2 to 5 per million, which is better than the influenza vaccine. This unusual syndrome of thrombosis and clotting we talked about last town hall, there have now been 30 cases of the 9.6 J&J vaccine recipients and the 6 million J&J vaccine recipients. That's about 3 per million. That's extremely low, but I'm not that 3 per million. It typically occurs women age 18 to 45. That's dramatically lower. I mean, it's about at least a third as low as the risk of getting clots on oral contraceptives, frankly. And death associated with vaccine, there have been 0.00017% deaths in the time frame of getting vaccinated. These are being investigated now. I've not had one episode of death that I'm aware of in the Delaware region truly linked to vaccination. The vaccine adverse event reporting system of the CDC is excellent. It's real time. And I think we have the data coming out quickly. So we know the numbers are good. This is better than influenza vaccination. We also know this vaccine is safe in pregnancy, which is now well documented. This paper came out about 2 weeks ago as well. New guidelines, state of Delaware as of Friday, Governor Carney's most recent modifications. Masks are still required for all members of the public visiting the courts. When they are visitor of any state or operative facility, they must wear a mask. This is in that must remain vigilant guideline situation where you don't know who's next to you, who's in the elevator next to you, who's walking down the hall next to you, have they been vaccinated or not. This resolves that issue. If I am vaccinated, I no longer have to wear a mask anywhere. No, you are encouraged to wear a mask in healthcare settings when you're in a plane, train, public places. I went out to get something last night, and I was standing in line, and we're outdoors, and no one had a mask. Well, 2 people had masks on. I realized outdoors, vaccinated, no mask. Indoors, vaccinated, no mask if you're with vaccinated people. You're still in an area where the airflow is concerning. Unvaccinated people may be present. Masks are clearly indicated in that setting.
What's it like in the hospital now, doctor? Is everybody still wearing masks?
Oh, yes. I mean, I wear a mask constantly in the hospital, and no one's relaxed that part. These are sick humans, you know, and we do have visitors in the hospital now, which is just great because, you know, during the COVID, we had no family visiting. And so it was really hard to sort of have an advocate there for the patient. Now there are visitors in the hospital. It's labs are being done, outpatient studies. So the answer is yes, completely. There are apparently some exceptions to the mask guidelines, except when you're eating or drinking in a break room. And keep in mind, that's a high risk event, eating and drinking in a break room. So be careful. And I'm not going to say cut your lunch short. I personally never miss a meal, but I think you need to be careful. And I think these dates are up there for reminders that tomorrow and the 27th, there are further vaccination clinics driven by the courthouse. And I'll leave that further discussion to your team. But I can see very few reasons not to get vaccinated. And I think as the evidence and data comes out, and as you watchful 17% of the state of Delaware look out at this, you'll hopefully feel more comfortable. We want you to feel comfortable. I think that's important. You're part of the system. I think I'll stop there and entertain any questions.
So thank you, doctor, very much. And just a little more detail on those vaccination events. It's going to be the one shot Johnson & Johnson. So for employees that are still looking to get a vaccine, the sign-up information has been sent to you. It's one and done. It's being brought right to the physical location where you are. So hopefully we can convince some more people to take advantage of that. Dr. Bacon, as always, thank you very much for spending your time with us today. We really appreciate it. Let's hope as we continue, and maybe when we do the next one, maybe it'll be our last one, and we'll be cheering. We'll raise a glass and make a toast to being on the other side of this.
We all have more work to do, though, but thank you. Appreciate all you're doing.
Thank you very much.